Bismillah ar-Rahman ar-Rahim. I am Dr. Nizamuddin Uthmani and I welcome to all of you to this first lecture of the general pharmacology, and the topic is Introduction to the General Pharmacology as well as Introduction to the Nomenclature. So today we will discuss about different definition and different words which are used in pharmacology. So this is basically the basic concept. You must learn these basic things because we will use these words most of the time, like pharmacokinetic, pharmacodynamics, pharmacy, drug, prodrug. So these are the different words. We will use these terminology at different stages of teaching this pharmacology. So you must get yourself familiar to these words. Now, for every lecture, there are some learning objectives. So learning objective for this lecture are define pharmacology, then describe the basic concept of pharmacology, then describe the different branches of pharmacology, then describe the drugs. What is the drug? What is pro-drug? What is orphan drug? And so many other definitions we will discuss, inshallah. And then describe the different nomenclature of the drugs. Like we will use different words. Like this is the chemical name. This is the brand name, and this is the generic name. So we will be using these different words during our coming lectures. So you must know about these things. And then describe the other terminologies what we are using in the field of pharmacology. That is also very, very important. Now, coming to the main definition of pharmacology. Pharmacology is basically the study of drugs. It is the study of the chemical substances. So these chemical substances, when they are given to the human being, when they are given to the animal, when they are given to any one of the living tissue, they will interact with certain receptors, and then they will perform certain chemical functions. So all those chemical substances, when they are injected or when they are introduced into the living tissue, and when they produce their action through the chemical process, we call that substance as a drug. Okay, so the bookish definition of pharmacology, it is a branch of the medical sciences which deal with the study of the chemical substances that interact with the living system through the chemical process. So what is that chemical process? That chemical process is basically the binding of this drug which occur with the regulatory molecules, and then those regulatory molecules then either produce the beneficial effect in the human body, like the therapeutic effect, or it may produce the harmful effect in the human body or in the animal body or any other living tissue, and we call that as the harmful or the toxic effect of that particular drug. So what occur basically? These drugs or these chemical molecules, they either stimulate those regulatory molecules or they either inhibit those regulatory molecules. So either by inhibition or by stimulation, these drugs basically they modulate, they bring changes in those regulatory molecules, and they finally produce their action. So they either increase or decrease the physiological activity. Like suppose if your heart rate is your physiological activity, heart rate is your physiological. So if you give it some drugs like the beta blockers, they will decrease your heart rate. So this is decreasing of the physiological activity. Like if you give some drugs like the beta 2 agonist, they will increase your heart rate. So this is the increase of the physiological activity. So the first thing is they will either increase or decrease the physiological activity. The other one, they will stop the pathological process. Like suppose if you get some sort of arrhythmia, some different rhythm in the heart, and if you give the drug like amiodarone or any other drugs, they will stop those rhythm, which is a pathological process, which is not normal physiological process. So it will stop that process. Okay, like suppose if somebody has got osteoarthritis, like osteoarthritis of the knee joint, so this is a pathological process. At the same time, if you give the drug like corticosteroids, and if you give the drugs like what we call as the DMRs, and if you give the drug like NSAIDs, what we commonly call as painkillers, so those drugs, they will stop that pathological process. That will stop that pathological process. So either by this inhibition or by stimulation, they will either they will kill the microorganism, and at the same time they will also kill the cancer cells. Now, going toward the history of the pharmacology, you know that before 18th centuries, there was no proper research. There was nothing properly written about the different sciences in the world. Similarly, regarding the pharmacology, there was no documented proof with anyone. They were using different ailments. They were using different, different drugs in different portion of the plants and animals, and they were even applying the mud and they were considering that this thing is beneficial for them, so they're supposed to use that things. Okay, but most of the time it turned out to be harmful for them. All the time it was not beneficial for them, and most of the time, instead of giving benefit to them, their things turned out to be harmful for them. There were also some other concept that suppose if somebody is injured with a weapon, so they used to apply those ointment on the weapon as like like not directly on the wound, but they were applying those ointment on the weapon, and they were considering this as a healing process for the wounds and different injuries. Then in 18th and 19th century, doesn't there was not sufficient changes, but the science has started a little bit. The people have started reading the things, no? But again, there was no proper process of purification and drug synthesis. Again, they were using different chemicals, but they were not, sure about the adverse effect. They were not sure about the uses of and the mechanism of action of all these things. So what happened later on in 19th and 20th centuries? Other subject of science like chemistry, like biology, like human nutrition and physiology, they have started a little bit, development, and the people were using different subjects, and they were doing research in different subject. So similarly, the same research occur in the field of pharmacology as well. Okay, so and now in the last 40 years, these were beautiful, these were marvelous. A lot of research was done, and most modern techniques of the drug synthesis, they were introduced. Now they are preparing most of the drug through the genetic engineering. They are working on the gene therapy. They have developed the receptors. They know the structure, the each and everything about the receptors. They are now developing the molecules which can easily fix to that particular portion of the receptor, and they either stimulate that receptor or you can say they can inhibit those receptors. So the last 40 years were it has totally changed the world. It's not only in the field of medicine, but in every field. You can say in the technology and every field, it has changed the whole shape of the scientific invention. And now this new thing like the nanotechnology is basically mainly focusing on the delivery of the drugs directly into the site of action. They are using the different techniques where they can deliver the drugs directly into the site of action, and they can minimize the adverse effect. Like suppose if you take a drug orally, it will reach to each and every cell of your body, because it will have to circulate through the blood. And now through with the help of the nanotechnology, they are making different sort of tracers molecules, and they are making different sort of techniques where they can directly deliver into the target tissue, and they can decrease the systemic adverse effect. And now the gene therapy, we have a slide. There are different options of the gene therapy, and their gene therapy has especially done marvelous work. nervous system. Now, there are two other terminology. One is called as the medical pharmacology and the other one is called as the toxicology. So, medical pharmacology is basically related when we are prescribing, when we are using the drugs for good effect, for the beneficial effect. We are giving the drugs, and that drugs, that chemical, it produce the beneficial effect in the human body. So, this is the branch of pharmacology which deal with the study of chemical substances which are used for the benefit of the patient. Yeah, the benefit of the patient is either the prevention of disease, or you can say the treatment of the disease. So these are the chemical which are used for the prevention, for the diagnosis, and for the treatment of disease. So this is medical pharmacology. And the other one is the toxicology, which deal with the toxicity or the undesirable effect of these chemical substances or these drugs. So the bookish definition is the undesirable effect of chemical substances on the living things and ecosystem. So this is the study of the adverse, you can say, of the toxic effect of a drug or a chemical. So we call that as a toxicology. Like suppose in this diagram, suppose a chemical, if it is used or if it is exposed to the environment, it will pollute the environment, and it can produce toxicity in the whole environment. Okay, now that chemical, if it is given to the patient, and patient, it will either produce the therapeutic effect or they will produce the toxicity. Okay, so chemical, we don't know. Initially, human were not knowing about the characteristic of different chemicals. So any chemicals they have used, they have tried. Later on, it was found that this has got therapeutic effect, so they have labeled that as a drug, and the other one has got toxic effect, and they have labeled that as a toxin. Okay, so the knowledge, the study, the field which is relating with that therapeutic effect, we call that as medical pharmacology, while the knowledge, the study, the application of all these practices to the drug, which is related basically with the toxic effect of the drug, we call that as a toxicology. Then there are some other definition like drug. Drug, most of the time we ask in Viva, define the drug. Okay, so drug is any chemical substance which produce its action in the body, and it basically change the physiological and pathological process in the body. You can simply say that these are the chemical substances. If it is given to the person, it's either modulate or explore the physiological process, and at the same time they can explore and they can also modulate the pathological process. Initially, I have given you the example of tachycardia, like the heart rate. So heart rate is a normal physiological process. If you give a drug which increase that physiological process or decrease that physiological process, so that is a drug. And similarly, like suppose if somebody has got diabetes, his sugar level is high, so that is a pathological process, and that pathology can be reversed by the drugs which can modulate that pathology. So according to the WHO, any substance or product that is used to explore or modify either the physiological or pathological states of the living things for the benefits of the recipient. Okay, so this is a little bookish type of the definition, but you must make a concept that the drug is a chemical substance which is used to explore both the physiological as well as the pathological process of the living tissue for the benefit of the recipient. Then we have got, we will discuss later on when we will discuss the pharmacology in detail, that some drugs, they are active drugs, and some drugs, they are prodrugs. So active drugs are those drugs which doesn't need any sort of activation in the human body. You just give the drug and it will work. While the prodrugs are those drugs when it is enter into the human body, they are converted into the other drugs and they get stimulated, and so we call that as a prodrugs. Okay, like levodopa, it is converted into the dopamine, and diazepam, which is used for the sleeping, it is converted, and by itself diazepam is a prodrug, it will not work. In the body, it is converted into the oxazepam, which is the active form of the diazepam, so that will work. Okay, then coming to the poison. Poison is basically any chemical substance which has a toxic effect on the living organism or the ecosystem. Okay, any substance or chemical which is toxic to the living organism is called a poison. Okay, but in case of drugs, sometimes a drug in a small dose, it will be a drug, it will have therapeutic effect. but at a higher dose, the drug which has a number of therapeutic effect, that may become a poison. Okay, so the Paracelsus in 1493 and 1541, he has stated that the dose makes the poison. And like aspirin, in a small dose, it has a number of therapeutic effect, but in a larger dose, it can kill the person. Like paracetamol. Paracetamol in a small dose we use for fever, for headache, and for so many other purposes. While in higher doses of more than 20 grams, more than 20 grams, 10 grams, it can cause failure of the liver, and it is very much hepatotoxic. It can lead to death. Now, we will be using two words. One is poison and the other one is the toxin. So the toxin is that particular poison which is coming from the biological origin. Like when it is coming from the plant or from the animals, we call that poison as a toxin. An antidote is any substance which is used to reverse the adverse effect, or which is used to reverse the effect of any one of the poison. We call that as a antidote. Pharmacovigilance is also called as the drug safety. Pharmacovigilance is basically related with the monitoring, with the reporting, with the collection of data, and with the prevention of the adverse effect of the drug. You know, adverse effect is the sixth or the seventh leading cause of death in America. We don't know about our own data because there is no such a monitoring. But in America, it is about it. I think it is the seventh leading cause of death. So pharmacovigilance is very important. It is done before the launching of the drug, and it is also done after the launching of the drug. Okay, just to prevent the adverse effect of that particular drug. The other term that we will be using in our lecture, that is the OTC. OTC stands for the over-the-counter medication. Those medication which one can get from the pharmacy without the prescription of a registered medical practitioner. So without a qualified doctor's prescription, one can get these medicine from the market, and we call that as a OTC. Like paracetamol is an OTC, iron preparation, folic acid. These are the OTC. But unluckily in our country, every single drug is OTC. You go to the pharmacy and you tell them, give me the poison, they will happily give it to you. You tell them to give me sleep pills, they will happily give it to you. They can give you anything. Okay, and that's the reason that why we are facing a number of antibiotic resistance in our country, and we are also facing drug addiction because people, they take these different sort of cough syrups, where codeine is more common in that. They use these drugs as a for the purpose of addiction and other things. And then the prescription drugs, other than the OTC, the drugs which should be used, which should be dispensed by the pharmacy to the patient only on the prescription of the registered medical practitioner or a qualified doctor, we call that as the prescription drugs. The other word we will be using is the orphan drugs. Orphan drugs. Orphan drugs are basically those drugs which are used for a very limited number of diseases, or the drugs which are used for a disease which is very rare. Like suppose if a disease is very much rare, like if the people are using the digoxin for the atrial fibrillation, and digoxin toxicity is very rare. It's very rare. So we use a drugs, we call it the digoxin antibodies. So digoxin toxicity is very rare. Similarly, the use of the digoxin antibody is very rare. That's why most of the pharmaceutical which are basically promoting these drugs for the purpose of money, for the purpose of commercial purposes, so they don't invest in this field because there is no much use of that particular drug. So that type of drug, we call that is the orphan drug, because very least number of pharmaceutical they get interest in that, and very least number of pharmaceutical they usually develop that particular drug. Then coming to some other terminologies like essential medicine. Essential medicine, there is a long list of the WHO. These are the medicine that should be available to every person throughout the world, either whether they are living in the richest country or whether they are living in the poorest country. These drugs should be easily available to each and every person throughout the world. Now there are two things. Number one, it should be in sufficient quantity. Number two, it should have a very good quality. And I can add the third thing, the price of these drugs will be within the reach of the poorest people of that particular country. Whether either it should be given free of cost to the patient, or it should be given at a price, at a very low price, at a very small price. Okay, like the paracetamol, it is an essential drug. Like these iron preparation, essential drug. Like the anti-tuberculosis drug, these are essential drugs. So they are usually either available free of cost, it is given to the patient in the government hospitals, or they can be taken from the market. The price is not usually that much high. Therapeutic is, we use some portion of the drugs for the diagnosis. We used some portion of the drugs as a toxin. We used some portion of the drugs for only for the treatment of disease. So when the pharmacology, or when the drug is used only and only for the treatment, that particular field is called as the therapeutic. Yeah, that particular study, that particular aspect of the pharmacology is called as the therapeutic. When it is only and only related with the treatment of a patient, we call that as a therapeutic. Okay? And we will also use the word therapeutic effect. We will also use the word therapeutic. Like suppose if we are giving the drug, like suppose you are giving the beta blockers. So the beta blocker has got therapeutic effect that it will bring down the heart rate, it will bring down the blood pressure. So this effect is the therapeutic effect, and this, for using that particular purpose, the aspect of pharmacology, we will call that as a therapeutic. And the other one is the pharmacy. Pharmacy is a different field, It is related with the pharmacology, but it is completely different, because it's basically deal with the synthesis of the drug, with the especially in the pharmaceutical industry, with the packing of drugs, with the storage of the drug, with even the dispensing of the drug. Okay, so being a doctor, you can prescribe the drugs, but this is the responsibility of the pharmacist who has done training in the pharmacy, who will dispense the drug according to the schedule dosed, written by the registered medical practitioner, or the competent, or you can say the qualified doctors. There are other terms like pharmacogenomics or pharmacogenetics. Pharmacogenomics or pharmacogenetics is basically the study of these genetic variation that cause differences in the drug response among individual or population. This is basically the exploration of the genetic makeup of the human body and its relation with the use of the different drugs. So we can say like we were using the interferon in case of hepatitis C. So though some people, they were very much responsive to the drug, while other people, they were not that much responding to that particular interferon. So what happened later on? It was found that there is a particular gene which is related with the virus, and there is a particular gene in the human body which decrease the response of the human to that particular drug, like that interferon. So this is basically the application of the genetic study for the use of different pharmaceutical drugs. Gene therapy is specifically, if somebody asks you what is gene therapy is basically targeting that particular gene or the introduction of that particular gene. Okay, pharmacogenetics or pharmacogenomics, it is a little different from the gene therapy. Pharmacogenetics and pharmacogenomics, we identify the gene which decrease the response to a particular drug, while the gene therapy is directly the introduction of a gene for a particular disease. Like these are some conditions like gene knockout. Gene knockout means when you remove the genes, so the disease will get automatically treated. Like nowadays, most of the people, they are doing research on the gene knockout in case of cancer. Like suppose some cancer may be responsible for the development of a particular cancer. Some gene may be responsible for the development of a particular cancer in some families. So if that gene is identified, and if their genes is removed by knockout techniques, the person will not develop the cancer. Some genes, they are responsible for the development as well as for the propagation of cancer. So if somebody develop a cancer, and if that gene is identified, and if that gene is removed by knockout technique, the cancer will be there, but its propagation will get stopped. So okay, so this is called the gene knockout. The other one is the gene knock-in. So you introduce a new gene for the treatment of a disease. And the other one is the gene knockdown. One is the knockout, complete removal of the gene, knock in intrusion of a new gene, and knock down, suppression of the gene. Like suppose if some gene is involved in the development of a disease or a cancer, you introduce the process where you can suppress that particular gene, you can decrease the function of that particular gene, and the person will get recovered. So in future, genetic screening will become the commonest tool, hopefully in every patient, and this will decrease the cost of using pharmacotherapy and the cost of surgery and different things. If we can identify the genetic makeup of a human who has developed that particular disease, then we can easily modulate the gene, and we can easily treat that patient without the use of the drug. The other thing is the chemotherapy. What is chemotherapy? This is the branch of pharmacology which deal with the killing of the microorganism or killing of the cancer cell with the help of the drugs. So this is chemotherapy. So all those drugs which are used either for the killing of the microorganism or for the killing of the cancer cell, we call that as a chemotherapy. And then the pharmacopoeia. Pharmacopoeia, it's basically these are the written books. Where there are the principle of the drug, where there is basic description about the physical and chemical characteristic of drugs, where there are different tests available to test the quality of that particular drug and to test the purity of that particular drug. And there are information regarding the storage, regarding the transportation. You know, if you open that book for a single drug, you will get the complete information of a drug, that from where it came, how it is developed, how it is stored, how it is transported to the different pharmacies, how you can check the quality and purity of that particular drug. So these things are written in different books, and we call that as a pharmacopoeia. There are different pharmacopoeia, like the British pharmacopoeia. Whenever you read the pack of the medicine, you can see that BP, IP, USP, EP. So these are the different pharmacopoeia they are following for the development of the drugs. So one is the British pharmacopoeia, the one is the United States pharmacopoeia, Indian pharmacopoeia, and then the European pharmacopoeia. So when you see on the pack where it is written BP, so it means that this particular pharmaceutical is following the principle which is written in the British pharmacopoeia regarding that particular drugs, that how this drug is synthesized, how this drug is stored, how this drug will be transported, how this drug will be stored, and how this drug will be dispensed to the people. So these you can see on different pack of the tablets, BP, USP, they are using different pharmacopoeia. The other one is the formulary. Formulary is a sort of book, or it is a sort of, it's available in the short form, it's available in the hard form. This is just, you open that book and you will see that which type of drugs they are available in that particular country. Like suppose we have different antiviral drugs. Some of them they are available in Pakistan, some of them they are available in India, but most of them they are not available in every country. So for every country, every region, there is different formulary. In our region, some drugs are available, so those drugs are included in our formulary. While those drugs may not be available in other part of the world, they have different formulary. So formulary is basically those drugs which are available in that particular area or in that particular country. We call this as a formulary. The other two terminology is the pharmacokinetic and the other one is the pharmacodynamics. Pharmacokinetic is basically related with the movement of the drugs. Pharmacokinetics, it's related with the movement of the drugs, and how the drug is taken, how the drugs circulate throughout your body, and how the drug is removed from the body. So it basically related with the absorption of the drug, with the distribution, with the metabolism, and finally the removal of the drug. So it means that what your body does with a particular drug, we call it as a pharmacokinetic. And the other one is the pharmacodynamic. Pharmacodynamic is basically the mechanism of that particular drug, that how the drugs produce its action. So that mechanism of drug, or that therapeutic effect of a drug, or that adverse effect of a drug, we call that as a pharmacodynamic. Like suppose if you take aspirin, aspirin will work on your platelets. So that how it work on those platelets, this is the pharmacodynamics. This is the pharmacodynamics. Aspirin will cause, it will cause a gastric problem. How it causes that? This is what adverse effect what is that particular mechanism through which the aspirin causes the toxicity of the stomach. That adverse effect is called as that process is called as the pharmacodynamics. The other thing is the receptors. We will discuss this again in detail when we will be discussing the pharmacokinetic in detail. Pharmacokinetic and pharmacodynamics have got separate lectures. We will discuss in detail. So there we will discuss the receptor. Receptor are basically the target molecules where the drug bind to it and produce its action. The receptors, some of the drugs, they will bind with the receptor and will stimulate that, and we call that as the agonist. Some of the drugs, they will bind with the receptor and they will inhibit those receptors, and we call those as a antagonist. There is another word, hormones. Hormones is basically that are the drugs which is synthesized inside the human body, your own body, inside the body. We call that as a hormones, like insulin. It is a drug, but it is a hormones, like growth hormones, like prolactin, okay, like thyroid hormone. So these are basically the drugs, but at the same time they are the hormones. Okay, there are two other words. One is called the adverse effect, and the other one is called as the side effect. Adverse effect and side effect, both are, you can say these are same, both are unpredictable, both are undesirable, both are unacceptable. But adverse effect are you can say it is more in intensity as compared to the side effect. So side effect, you can say, suppose if a drug has got a lot of therapeutic effect, but at the same time it has got a little bit of side effect, we can accept it. But adverse effect is not acceptable. Adverse effect, if somebody get the adverse effect of a particular drug, usually that drug is avoided for another use in that patient, while side effects are usually acceptable. Like suppose if you are using the metronidazole for diarrhea, for amoebic dysentery. So metronidazole is used, they kill the amoeba, and you get the desired therapeutic effect. But at the same time, they produce a bad taste in the mouth. So this is a side effect which is not the you can say it should not be there, but you can say that it's okay. It's not that much severe, which can threaten the life of a person. So adverse effects, they're usually more in intensity, while side effects, they are less in intensity, and they are usually acceptable. Some other definition, like we will be using the chemical name. Chemical name is basically the name of that particular molecules, which is given by the scientist. It is based on the chemical structure. Like suppose in case of paracetamol, the chemical name is the N-acetyl-pheaminophenol. It's a difficult word. It's a difficult name. Then it's come the generic name. Generic name is also called as the non-proprietary name. Generic name is also called as the non-proprietary name. And this generic name is given to a drug by different committees, even by the WHO, by the different nomenclature committees. When they discover a drug, they discover their chemical structure, so they write down their chemical name. And then for the ease, they gave another name to that particular drug which is acceptable throughout the world. So that name is called as the generic name. And the third one is the brand name. So whenever a pharmaceutical take their particular salt and their particular raw material, and if they develop their own brand, so they can give a separate name, a proprietary name. It is their right, it is their property, so that become a proprietary name, and we will call that as a proprietary or a brand name. Okay, like suppose paracetamol, it was invented, and the name was given N-acetyl-pheaminophenol. Now the word has thought that let's give a name to this drug which is acceptable and which is easier for the people, so that they can easily understand it throughout the world. So they have given them the name as paracetamol. Now suppose if there are 10 companies, and if they buy the raw material of the paracetamol, they will make different brands. Some will give the name as the Panadol, the other will give name as Calpol, the other will name with some other names. Okay, so then those names will become the brand name. That brand name will be only attached to that particular company, while the generic name is acceptable throughout the world. Most of the time in Europe and America, the people use the generic name for the prescription, while here we usually use the brand name. Okay. Then coming to the drug nature, you all know drug may be either in the solid form, or it may be in the liquid form, or it may be in the gas form. Solid form like tablets, like suspension, like capsule, while in the liquid form we have syrups, we have infusion, we have injection, and in the gaseous form we have different anesthesia like nitric oxide and so many other things. The drug size, it's usually it may be different from different drugs, but usually it falls between 100 and 1000. Okay, so we have some drugs like TPA. TPA is a drug which is used for the treatment of acute MI. It is a thrombolytic drug. So it is used for the intra-arterial thrombosis, and it has a molecular weight which is very much higher. Now, what is the importance of this of the size of a drug? The drug with a higher molecular size, it will not penetrate through all the membrane, and it will not reach to the site of action. So this TPA is basically designed to produce intra-arterial action. So we gave the drug intravenously, it reached to the heart, and from heart it is circulated in the arteries, and it's produced its action. So it is not needed in the tissue. So there is no need to permeate these drugs into the from different membrane and reach to the tissue. So basically the drug size, it's gave you an idea about the distribution and about the target organ where this drug will reach. Another thing is the drug shape. The drug shape, previously they were used to design this drug, a drug that this drug has got less affinity for the receptor, and the other drug has got more affinity for the receptor. But nowadays it is not in use. You all know about the shape of the drug, that this drug is, it has got a particular shape where it can easily fix into the molecules. The other words which are used is the chiral and the enantiomer. Enantiomer are basically the mirror image. Like suppose your two hands, they are the mirror image of each other. But if you start counting, like if you start from the right hand, if you start counting, you will go like this. So this is like S pattern. While in the left hand, you will go like this. They are actually the mirror image of each other, but they cannot be superimposed upon over one another. The reason is that, like suppose we have these two drugs. Like suppose we have these two drugs. Let me tell you. Like suppose we have these two drugs. Okay. So if I draw a shape of this drug, if I start from Br, like bromine, and then hydrogen chloride, and then CH3, it will go like this. Suppose this is Br is 1, H is 2, Cl is 3, and Ch is 4. Again, if I count like this, that Br is 1, H is 2, Cl is 3, and H3C is 4. So if I start moving, I will move like this. Okay. So like from 1 to 2 to 3 to 4, and in case of this one, I will go from 1 to 2 to 3 to 4. So these two, they are the mirror image of each other, but they cannot be superimposed upon one another. So this is called as the enantiomer, and they may be positive enantiomer or maybe negative. So these, the positive is represented by the R and the negative by the S. And these drugs have got different affinity for the receptors. In some cases, we use the positive enantiomer of a drug. In some cases, we use the negative enantiomer of a drug. And most of the time, unluckily, nowadays, different pharmaceutical, they use the mixture of these drugs, the mixture of these different enantiomer, and we call that as a racemic mixture. We call that as a racemic mixture. Now coming to the rationale of drug design, how they design the drug. Rationale is basically when you know exactly about the structure of the protein, then you can make particular molecule to bind, to get fixed in that particular receptor and produce its maximum action. Previously, it was done mainly by using the clinical efficacy. Whenever they were using to identify the new drug, they were thinking that this drug has got more efficacy, so this is fine. Nowadays, they work on the receptor first, then they get the molecules. They initially work on the receptor. They identify the receptor, and then they find the molecule which can easily fix into that receptor. Like suppose this one will come here and this one will come here. Then they identify, like there are many molecules, but these two can easily fix into in that particular receptor. So they will work on these two molecules. They will not, they will not work on the other molecules, because these two molecules, they can easily fix into that particular receptor. So this is basically the rationale regarding the development of new drugs. Nowadays, more advanced technology is used. There are different software in the computer, different computer system where they can identify the structure and where they can use the different technology for the identification of drugs. Now, these are the last two slides. How pharmacology develop? You must visit and you must watch this video on pain, pus, and poison. This is a BBC series by Michael Mosley, the BBC video series. These are 3 videos, each about 35 or 25 minutes. So these 3 videos on pain, pus, and poison, and you will know a lot that how much the scientists have suffered for the development of these drugs. So you must visit to the YouTube and watch these 2 videos. Again, I will upload this lecture on my own YouTube channel. So those who have missed this lecture must visit my YouTube channel. This one, this Pharma Medica, it is specifically for the pharma lecture. While the other one on my own name, Dr. Nizamuddin Uthmani, I am sharing a lot of medical information regarding the new disease, regarding the new drugs, regarding the new therapeutic approaches. So you can visit both of these YouTube channels, and you can watch. If you missed the lecture, you can watch again the video on this channel as well. So I will request all of you to must visit these YouTube channels and subscribe it, and hopefully you will learn a lot about a lot other information about the health and the current issue. So with this, I came to the end of my today presentation. Thank you, thanks all of you. Thanks, Melian. Thank you very much. God bless you all. I'm really waiting for your comments and your feedback. You must share your feedback, your comments. Though this video is a bit lengthy, I am trying to improve my presentation style so that to bring it to the shortest version and to present it in a more beautiful way. I'm trying on it, and your feedback, your help, your support is very much needed. So must subscribe to my YouTube channels, Pharma Medica and Dr. Nizamuddin Uthmani. Watch this video, share with your other colleagues from different medical colleges, and I hope we will have a long way to go, and we have to learn a lot. So you will go with me. Thank you very much. Thank you so much. God bless you all.